works. Yeah. More than 1 in 5 people will be diagnosed with cancer in their lifetime. Not only does cancer takes life, it can also damage families, destroy livelihoods, and cripple communities. Assalamu alaikum and good afternoon. I'm Dr. Asya Nabi, Assistant Medical Director and GP, live from our official social media pages. Health awareness focusing on early detection, timely diagnosis, and comprehensive management can save million lives from cancers in future. On this World Cancer Awareness Day, Prime Health encourages everyone to learn about the most common cancers so that they can act now to detect them earlier, diagnose them quicker, treat them better. We hope for a world where no one dies from preventable cancers or suffers unnecessarily, and everyone has access to cancer treatments. The most common cancers in the world are breast, lung, colon, rectum, and prostate cancers. Today, let's discuss about some of the most common cancers in general. So with this, I would like to invite my first speaker on this webinar today. We have with us Dr. Arun, with over 11 years of experience in treating solid tumors, blood cancers, and benign hematology. Dr. Arun Karanwal is a specialist medical oncologist at Prime Hospital. His experience encompasses all types of oncology patients. This includes the treatment of solid tumor, acute leukemias, lymphomas, chemotherapy administration, palliative care, including both adults and children. Having excellent decision making and people management skill, Dr. Arun Karanwal has successfully interacted with patient, all level of management and his staff during his career. We welcome you, Dr. Arun, on this program.
Thank you, Dr. Asya.
I would like to invite my second speaker on this webinar today, Dr. Virishka Mukesh Mansukhani, a specialist surgeon at Prime Hospital, has extensive experience in surgical oncology and a keen interest in breast cancer surgeries. A 15-year veteran in her field, she has a wealth of experience. In addition, she is a member of Royal College of Surgeons of Edinburgh. She is an active speaker recognized internationally. Dr. Virishka, as an active member of the wellness and health community for women, she plays an invaluable role. We welcome you, Dr. Virishka.
Thank you, Doc.
Now we have with us third speaker on this webinar today, Dr. Vipul Agarwal, consultant urologist at Prime Hospital, has worked in the UAE for more than 8 years, has obtained an FRCS from University of London. In addition to his training with India's leading urologist, he brings with him 15 years of experience. Most importantly, Dr. Vipul has done over 15,000 endoscopic surgeries and successfully treated complicated staghorn kidney stones and an enlarged prostate. He is also actively involved in treating patients with urinary incontinence. We welcome you, Dr. Vipul. I would like to start with the basic question with Dr. Arun. What causes cancer to develop and who's at risk of developing cancer?
Okay, so to start with, I would try to just explain what is cancer. Basically, it is a autonomous growth of cells in our body, which are not hindered by any mechanism, and they continue to grow out of control, become a cancerous malignancy at some point of time. There is no clear answer we can get, like what is the cause behind each patient's cancer. However, there are certain risk factors which we got to know from so many years of research that if this factor is present in any person's life, then the risk of developing or the possibility of developing a cancer in that person will be more than the other person who does not have that risk factor. So these common risk factors which are important to understand are our most of them are related to our lifestyle changes, and they include exposure to tobacco in any form, including smoking, tobacco chewing. Alcohol is also one important factor. Some factor related to our lifestyle like obesity and sedentary lifestyle, they are also very important, and in the long term they can increase the risk of different type of cancers. There are certain factors which are not in our control. They include hereditary changes or the certain mutations which can pass on to the family members, and they increase specifically certain group of cancers. There are certain risk factor like exposure to radiotherapy in the past, particularly the like chest radiotherapy can increase the risk of breast cancer. So these are the common risk factors which increase the possibility of developing such disease. But whether the person will develop a disease, it is not like we cannot say 100%. So we have to just try to see whether we can reduce this kind of risk factor in from our life, so that we reduce the risk of cancer. Dr. Askia, I think you are muted.
Thank you very much, doctor, for this information. For almost every person on this earth, cancer is a very big word. I believe there has been nearly centuries. We are hearing about cancers and things like that. Is there something really a concern for people that there's a lot of misinformation going around? What is that particular thing in the beginning of session you would like to highlight for everyone to know about when it comes to cancer, knowing it or learning about it? What is that particular advice in general for every human?
So most important thing which we need to understand is that it is a growing there's a growing incidence of cancer disease worldwide, and we are seeing more and more number of new cases each year, and that all depends on our lifestyle changes which happened in the last 50 years, 100 years of time. And how to detect it early or prevent it, the most important factor will be to have a awareness about it. After understanding this kind of disease, then only we'll be able to be more active or more proactive to uh, do some necessary changes in our lifestyle, to do more screening for detecting it early, and to go for early diagnosis to start the treatment early. So most important factor is awareness.
As you correctly said, awareness, doctor. In UAE, who are the top, 3 or 4 most important concerns related to cancer? What everyone should know and go for early screening and prevention.
So the most important lifestyle factor, as I told, will be to control obesity incidence, and to improve our sedentary lifestyle by adding some good level of exercise. At least 15-20 minutes of exercise at daily basis will help to improve the general fitness. Reducing the exposure to smoking and alcohol as much as possible should also be considered. Other than that, we should try to go for early checkups and screening as per the current guidelines. Like, for example, for the ladies more than 48 years of age, we should start screening with the mammogram for the breast cancer. Same thing applies for the cervical cancer with the pap smear. And for certain other tumors like colon tumors, we can go for the stool checkup or colonoscopies. For the prostate, we can go for the PSA testing. So like that, whatever the best possible screening methods are available, we should utilize them as much as possible.
Thank you, doctor. So, Dr. Vipul, as we know that prostate is one among the top cancers in men. So, which age actually men should consider screening? And actually, we can start with what is prostate cancer. Dr. Vipul, you're on mute, doctor.
Can I be heard now?
Yeah. Please go ahead.
So prostate is a gland in males which contributes to the ability to have children. And there are certain changes that happen with age. So which is called prostate enlargement, but that is separate. Ideally, as per the latest guidelines, men over 40 should have at least once a year screening for prostate cancer. But more importantly, for those men who have family history of prostate cancer. So if somebody has his father, uncle, brother, grandfather having prostate cancer, he should be more diligent in the screening, because any direct relative increases the chances of having a prostate cancer manyfold. More so if the patient, if the relative has had early age of cancer, we should start at least 5 to 10 years before the relative was diagnosed with cancer.
Thank you, doctor. So you mean to say that if anyone is affected even in 40s, which is probably very less likely to see, so then the other family members, siblings should start screening 35 onwards.
Yeah. See, very rare to have a patient with 40 years of age and a prostate cancer. But then, yes, at least 5 years prior to that, we should start screening for prostate cancer for relatives of the patient.
Is there any way, doctor, we can go for genetic testing to find early the possibility of prostate high risk people?
Prostate cancer has a multivariate genetic inheritance, so we can't point out a single gene to do the assessment even before that. So genetic testing, I don't think will be helpful. The only good thing would be regular visit to the doctor, examination, and screening with serum PSA, and if in doubt, further evaluation according to the results.
Thank you, Doctor. Dr. Virushka, we have talked in past about breast cancer. So I would really like, breast cancer should not limit to October sessions only, and though numbers are really rising, and I believe it's one among the highest in UAE and around the world. What is today's advice for women again to go for screening, and some which is beyond the scope of book, which you have seen practically happening and you would like to share with people?
Yeah. So I think I can be heard, yeah?
Yeah, please go ahead.
As Dr. Asya rightly said, for women, it's leading to be the number one cancer for women in for breast. Of course, my youngest patient with Dr. Arun and me right now is around 26. 2 years back, it was 21-year-old. Of course, some had family history, some didn't have family history, but screening is so important. The patient, even if she was 26, her mother that was diagnosed at the age of 50, but still she came for screening with no lump felt, no clinical findings, but just she said, I'd like to do a checkup. On a checkup, the incidental finding was 6 months back. We did a biopsy for the lump, there was nothing. So basically, even after 6 months, she came back for regular follow-up. We picked it up, and that small tumor had changed to become malignant. So for women, I would like to say, although the guidelines say above 40 to come for screening, we are finding patients even at 20 and 21 in our facility who have been diagnosed, sadly so, with cancer. So screening should start much earlier, maybe with an ultrasound. And as Dr. Arun rightly said, a mammogram after the age of 40. So ultrasound doesn't have any radiation. So we advise women to please come for checkups, even if it is just for a 10-minute checkup, just to do an ultrasound. That's important. And then we keep following it up as per what we find. So as Dr. Arun said, awareness, most important to keep educating women to come for their checkups, especially for breast, thyroid, uterus, ovaries, and cervix. Yeah, so these are the most hormone dependent, and for women, it's the most important. As we know that there's a vaccine for cervical cancer, so this would be really helpful.
Thank you, Dr. Virushka. I think that was quite insightful, that we should not limit it to guidelines, but yes, we should not neglect that. At least if you are reaching to 40s, you should start screening yourself. But if you are in high risk, there is no age limit. We are seeing it practically. You have explained it also. So, Dr. Arun, what is the age of youngest patient with cancer currently, or in the past you have seen?
So, if in general, if you see, the cancer kind of disease can happen starting from early months of life. Like infant also can get different type of cancers. I have treated pediatric patient when I was in home country, and it can go to any age. Like any elderly age patient can have a cancer. So basically, it is a disease of all ages. But the commonest type of cancer generally happen in middle age group. The starting incidences in the middle age group. If we see the data from the developed nations like USA or the European countries, till now the incidence of cancer was more in the elderly group, like more than 60, 65 years of age. The commonest tumor like breast tumors or lung tumors, colon tumor, they generally were getting detected in the elderly population. However, what we are seeing now is a completely different trend in the developing nations like Asia and Africa, that the incidence is more in the early age group, like starting from 40, 45 years of age. We are seeing lots of patients who are getting diagnosed with the common tumors. So these are changing statistics of the cancer disease in different countries. And the unfortunate thing is that the incidence is still rising, and we expect that in the next 20-30 years, it will become even a further difficult disease to control. So it is important to be aware and start detecting it early so that we can give maximum possible chance of cure to all the patients.
Absolutely, doctor. I have one question, strange question from Mr. Arbab. Why animals not get cancer? Probably why animals don't get cancer. I don't have a reliable information on this, but probably you can speak something on this.
Basically, all living organisms can get a cancer because it is a disease of DNA, you can say, or genetic structure. Whenever there is some accumulation of DNA errors happen in any living organism, it can ultimately give a growth signal to our cells, and it can turn out to be cancer. So it is proven also that animals also had different type of cancers. However, because we are not hearing so much about that category of organism, and less information is available in general population about it, but they can also develop cancer.
Thank you, doctor. So as you correctly said that, the trend is changing, the data is changing. Now it is not something which we consider, elderly disease. Cancer used to be elderly disease. Now it has come to mid-level. So with this, Dr. Vipul, I think we can talk more about if there are symptoms related to prostate cancer, how a person should know about it, what are the things they should look forward, and how urgently they should go to a general practitioner or, for that matter, a urologist directly.
See, now the scary part is the prostate cancer when it is in very early stage, when it is purely curable, like almost fully curable, there are no symptoms. And that is why the awareness and the screening comes into role. Usually prostate cancer will cause symptoms when it has spread beyond the prostate into the body, or when it is pressing onto the nearby structures, which means it has already gone beyond a localized level. So this is a very, very important thing to understand, that no symptoms may not be no disease. So early screening, awareness, regular visits are very important. Yes, patients do come up with symptoms. In localized cancer, it may be symptoms related to passing of urine. It may be sometimes blood in urine, sometimes blood in stool, pain in the lower back, or there may be symptoms related to spread, which may be bone pain, pathological fractures, because prostate cancers commonly spread to bones. There may be blockage of kidneys leading to obstructive uropathy, but those are all late stages, and it is difficult, not impossible, but a bit more difficult to control the cancer. So awareness and regular screening and assessment is important to diagnose cancer in early stages, so when it is purely treatable and curable.
So in that case, doctor, we know practically, men will not go for ultrasound prostate because it is really not in the mind of people that, at least we have now breast cancer awareness to some extent. And we have seen people, women at least coming for screening. We do have Men Health Month and other things, but as compared to breast cancer awareness, we don't see that much increasing, uh, seeking knowledge about prostate, and it's very difficult to tell young generation at the current times, when everything is AI and world is more into technology. So will this PSA will be reliable if they do it on regular basis, yearly basis? What can help them?
See, actually, PSA is both a friend and an enemy. Of course, if a patient is aware and doing it on a regular basis, like almost once a year is the bare minimum, we can detect cancers very early. Like Dr. Varushka had a patient 6 months back, she have biopsy, nothing, then again came back. So a regular PSA screening at regular intervals will help us see if it is rising. And if it is rising, then we increase the level of assessment, evaluate on a detailed format with MRI, ultrasound, biopsies, and we can catch the prostate cancer early. So a serial PSA, not single value, a regular once a year at least PSA will definitely help in catching early cancers. Now coming to the ultrasound part, because beyond 40 and 45, a lot of men do have prostate age-related changes, so they do come to the doctors. So all doctors should take this opportunity. A patient coming to a man of that age coming to a urologist or a surgeon or a general practitioner with urinary complaints, they should simultaneously put in a screening for prostate by an ultrasound and a PSA, which is not a major thing. It's a very, very minimal test, and usually there is no issues on insurance, and that opportunity of visit of the patient for any urological problem should be used to put up a PSA screening and evaluate for early cancers.
Absolutely, doctor. I believe, like breast cancers, most of the general practitioners or gynecologists do take part in breast examination yearly or 6 monthly, though there is a lot of awareness. So I believe now this should also be increased. So do you agree what I say, that men still don't take part in the awareness campaigns and are not really keen on screening prostate cancers? Or,
I would say yes, it is right, absolutely right. But I would say more so because somehow the awareness is also less. I mean, if you compare the awareness among general population about breast cancer, or for that matter, cervical cancer, it is much more aware. But yes, for prostate cancer, the awareness is still a bit, I would say, in infancy. So we need to push more for awareness amongst men so that they come out of their inhibitions and come to the doctor for timely evaluation and screening.
Thank you, Doctor. Dr. Virushka, so we talk a little bit about breast cancer. I would like you to expand it a little more for young girls and ladies, how frequently they should check them, how frequently they should go to the gynecologist, and what is that particular sign or that helpful tip they should look for.
So screening, basically we would start from a young age of around say 20 to 25, where we teach the women how to do breast checkups. Self-examination is very important. Then we start, if we do find something or the patient does come with a symptom of either a lump or change in the skin color, change in the shape, nipple discharge, or itching around the breast, or some armpit swellings, then they should come to a screening where we do an ultrasound with it for young women less than 40. Even for women at 40 and older, besides an ultrasound, we do an mammogram. And if we find anything suspicious in both of these, we do an MRI. So till date, we have the MRI, which is the best investigation, but sometimes can overdiagnose something if it's just only some infection. After that, we do it at regular intervals, either 6 monthly to 1 yearly. If we find something in your ultrasound or in your mammogram, it will be short-term follow-ups. And if we don't find anything, then maybe every 6 months to 1 year. Mammograms, strictly, we try to keep it once every 2 years or once every year. Ultrasound once every 6 months, since it doesn't have any radiation. MRI for the high-risk groups, those who have a family history, or those who have some symptoms that we have picked up which need short-term intervals, then MRI. So this is how we would go about. And if you do have very strong family history of more than 2-degree relatives with less than 45 age, we do genetic testing also, which is just a simple blood test, which is done, which is called the BRCA gene, which is 1 and 2, which is a blood test. Once we get the report to check whether you have the mutated gene, then we can do something called preventive procedures.
So, doctor, as you said, 2nd-degree relative or 2-degree relative, that means your cousins, your aunts, your uncles, or...
And your 1st degree, but the figure is 2 relatives. I correct myself, 2 relatives, less than 45 years of age, who have been diagnosed with cancer, should also be considered then as, if you're a patient, to do the genetic testing.
So, is genetic testing available in UAE?
So in our facility, we do have genetic testing, but we send it to a lab outside the UAE, which is either to Europe or to India, where it is sent. But we don't have the lab primarily in the UAE as of now.
I believe in the world there are very less labs overall about genetic testing, and we can take. But the most important thing for every person to know is, if they have any single doubt, you can always speak to the specialist and not keep in your mind. Please don't Google. I always say in my all programs. Now we have Chat GPT also, so you have all the answers, but you cannot replace the specialist, and specialist definitely can guide you and give you the proper guidance. With that, Dr. Arun, back to the cancer topic. Do we have vaccine for any cancers till date?
Okay, so vaccine development in the cancer disease is basically in two different type of scenarios we are dealing right now. One type of vaccines are to prevent cancer, and if we see there are two important viral infections. One is the hepatitis B, and second is the human papilloma virus. So against both, there are good vaccines available, and they are very highly efficacious vaccines. That means they reduce the chance of getting this infection and ultimately leading to a cancer disease in the, after some years. So that risk is significantly reduced by using these vaccines, and it is highly recommended now to get these vaccines in the childhood immunization programs. So one research is going towards whether we can prevent cancer by using a vaccine. So these are two standard and proven things. With more research, maybe we'll get more vaccines in the general in our guidelines. And the second group of research is whether we can treat cancer disease by using a vaccine technology. So in that also, there's a till now we have one good options available in the prostate cancer, which is used for advanced stage or metastatic stage of the prostate cancer, and that vaccine can control the such kind of disease for some time. There are growing research in same kind of like treatable or therapeutic vaccines in other tumors also, but still they are not so much of strongly recommended by the guidelines. But hopefully in the next few years we will see good options in the treatment also.
I hope that answers Dr. Enamon's what he asked. Now, I have a very interesting question from the viewer. This is related to artificial intelligence in the current trend. So I can start with Dr. Arun, and then I will definitely ask my rest of the speakers. How important is AI reporting in cancers? Where are we currently, Doctor?
Okay, so basically the use of AI in any kind of healthcare sector currently is limited to important diagnostic testing, I can say, and also in the research part. So in the diagnostic testing, AI is helping to improve the quality of the reporting, or you can say the false errors or false negative result can be reduced with the using a AI technique. For example, there are new type of mammography or mammosonography kind of techniques are available, where they're including the AI support, so that the false positive, false negative results are minimal. So like that, it is becoming more important part in the diagnostics. I think not all tests are still based on the AI, but as the research grows further and as more standardizations happen in such testing, AI will be including in that part of the treatment. In the treatment part, still it is not used for major clinical decisions. However, AI is becoming important for the research purpose, where it is helping to understand or improving the statistical analysis of the research which is happening for different aspect of cancer prevention or diagnosis or treatment kind of scenario. So
But we can definitely rely on the sensitivity or specificity is very high when it comes to AI. AI is definitely an adjunct to current healthcare. It reduces the number, the overall turnaround time for to add. But definitely we need to see the specialist. I hope that answers Dr. Chisti's
human factor is still
question.
very important.
Human factor is required. So with that, Dr. Vipul, what is the role of AI in overall men health and specific relation to prostate health currently?
See, like Dr. Arun said, right now, use of artificial intelligence in treatment part is still under research. But yes, artificial intelligence has improved the diagnostic part. For example, for MRI, the interpretation is already using artificial intelligence, whether the MRI reads multimodal evaluation of MRI images, and then it puts the scoring on the findings of prostate. So, for definitely current and relevance to the present topic, prostate cancer evaluation by MRI uses AI, which gives a grading, PIRADS grading, which is called, and it helps in evaluating whether there is cancer present or not, and whether it's a low risk or high risk. So yes, AI is already helping us diagnose cancers more efficiently, and hopefully it will help us in treating also in future.
So directly, doctor, not direct question. Before the session, we always ask our patients if they have any questions. Some of the patients are very keen to know about RASM procedures. If you can just give few lines, what is RASM procedure and who should actually proceed for the same? Is it safe to use, or what is it all about?
See, Resume is not for prostate cancers. It is for prostate enlargement. What happens is with age, prostate enlarges. Like it's an age-related change in the body. It's not a disease. And when it enlarges, it presses on the bladder outlet. So the patients will have problems in passing urine. Now, in Resume procedure, it is a very, very state-of-the-art latest technology, and it is especially helpful in patients who are high risk for surgeries, because prostate is a disease of older age. So there will be patients with cardiac problems, history of stroke, patient taking multiple medications, diabetes, blood pressure. So in such cases, because it's a very, very minimally invasive procedure, it decreases the risk of prostate treatment to a very minimal level. In Resume, we inject high temperature steam into the prostate in the enlarged portion, and which causes internal death of the prostate, which is enlarged. Only the prostate which is enlarged, and which is gradually absorbed by the body. So there is no cutting, no laser, not even laser, I would say. It is a very, very safe. There is no risk of bleeding, and it is being successfully used to treat patients for prostate who are not fit for regular surgery. And also it is helpful in patients who are not able to tolerate medicines, because there are certain patients who have side effects which are not tolerable to medicine. So it is a very, very good and effective procedure for treatment of prostate enlargement, and we thankfully are regularly doing it in our hospital and private hospital.
Thank you very much, doctor. So it's a day procedure, I believe, and people can always seek it. And it is not a cancer treatment, but it is for anyone who has difficulty in passing urine and is being diagnosed with, enlargement of prostate.
Correct.
So, thank you, Doctor. Dr. Virushka, we didn't talk about colon cancer. As we all know, about 90% of colorectal cancers and deaths are thought to be preventable. If this is a really high percentage of colon cancers, but why still colon cancers are happening? What are that important symptom for everyone to know?
So depends on, so as we know that the colon they have two sides and a middle section. So we have the right side, the middle section, the left side, and then we have the rectum. So if we look at that, there are different kinds of symptoms. Patients most probably come either too late or they come with no symptoms. Very common is a change in the bowel habit. It can be either loose stools with constipation, or they can have blood in the stools if it's more on the left side or the right side. More obstruction symptoms, that means they can't pass a stool and they have a lot of bloating or distension of the abdomen is more on the left side of the colon. So all these are vague symptoms that a patient can have. And then abdominal pain, if they come too late, they can have jaundice because liver involvement, or bone pain because of the bone involvement, or lung, like cough. So we see patients most probably around 40s can start coming with colon cancers, but of course it can affect the general younger population if they have family history, or they have something called like polyps or the genetic mutations in the body. So there's something called colonic polyps diseases, inflammatory bowel diseases, which we are seeing more common, which are high risk for colon cancers. We see it in the young population, like Crohn's disease can also be ulcerative colitis because of the change in the diet, the sedentary lifestyle, as Dr. Arun said, more of junk food, more of red meats, more of less of salad, high fiber diet, more with constipation, alcohol, and smoking. So obesity has become a major bulk for colon cancers also. So if we have all these are risk factors, the chances of getting colon have also increased, especially in the men, but also in women we have seen it.
So doctor, to be very precise, because this is a long list, for patients to know, will it be appropriate to say a bowel movement of, abnormal bowel movement, whether it's constipation, loose motion, whether it's associated with pain, whether it's not associated with pain, for more than 3 months should seek surgeon opinion and should not take only fiber to correct it?
Yes, I agree. I agree with that. Yeah, with indigestion, yes, should come for a check. And if we don't find anything, that's a good thing. Then it could be like malabsorption. But means we've diagnosed or screened the patient for at least to rule out the major issue, which would be cancer.
And how do we screen cancers, colon cancers?
So for colon, we have a basic stool test that they normally do, which is the stool blood test, which is called to check whether there's blood in the stool. But sometimes that can come erroneous. It can be falsely positive. So we do at least 3 checks before we can diagnose the patient as negative and not to have cancer. But always coupled with either a anoscopy, that is a small scopy with sigmoido, or a basic full colonoscopy. The other test that we have, but we don't normally do it as a screening, is the tumor marker. Please note the tumor marker is not at all sensitive or specific for colon cancers. It is a blood test, but it is different. Sometimes the tumor cannot be secreting this marker and it can be falsely negative for that patient. So tumor marker, especially in colon, is only used for after treatment or during treatment to check the rise or fall if the patient was secreting that tumor marker. Genetic testing, we have some inheritary colon cancers, as I said, which is part of multiple polyps or multiple small growths in the colon. And then we also have some of the genetic tests which can be done, which can be offered to very young patients or high risk population.
Thank you, Dr. Virushka. Dr. Arun, Mr. Martin is saying most African countries are treating early cancer, but they have never been recognized by WHO. Is medical research, especially on cancer treatment, having a bias? So I'll not reply on this, but I believe we are getting better in treating. I think we should opt for more screening programs. At least we should go for at least for breast checkup. We can encourage ourselves for self-breast checkups and timely, screening. We have another question from Ms. Sunita. If both parents died of adenocarcinoma of the stomach, is there any risk for the children?
Yeah, so as previously mentioned, that the number of family members having a different type of cancer diagnosis and the age factor at what age they were diagnosed can help in calculating the risk to the other members of the family or the kids. So if both the parents had a history of stomach CA, then definitely there's an increased risk of either the stomach CA or some other type of tumor also in the children. However, it cannot be like it can be proven only with the help of genetic testing, and there are big panels for the genetic mutations available now, which can include whatever the proven mutations are there. They can check the full panel of those mutations, and if any mutation is positive, then it will be like we can say strongly that there is a very high risk of cancer development in the children, and then we can recommend to have a early screening or early checkup programs for such affected family members.
Thank you, Doctor. Mr. Athar is asking why is neuroendocrine cancer and what is neuroendocrine cancer and what's advanced treatment?
So it is a group of cancer which affect a specific cells of the body, which are called neuroendocrine glands, and it can occur in different organs or different parts of the body. It is considered to be a solid tumor, and whenever it is getting diagnosed, the treatment again depends on the stage and overall fitness of the person. Most of the time, if it is diagnosed in early stages and surgery is feasible or technically it is available, then the first treatment goes for the surgical excision or the curative intent operation, followed by some time with other medicines. In advanced stages, most of the time the treatment depends on controlling the tumor with the help of some specific medicines like sandostatin kind of injections or some new targeted medicines. So it depends on the stage when we are getting diagnosis with the tumor.
Thank you, Doctor. Now, since we are moving towards the last segment of the webinar, it's very important for all of us to know what is stages, what do we mean by staging in cancer, and how does it really matter for the treatments. If you can elaborate a little about staging of the cancer, and we can ask then respective speakers also the treatment at particular stage from their end.
Okay, so staging is very important analysis or the evaluation for any newly diagnosed cancer patient, and it helps in making a treatment decision. It helps also in giving a idea about curability or the cure chances of such person. And depending on the stage, we make a full plan of treatment for each newly diagnosed person. In general, the staging for the solid tumors which are not related to blood, like for example breast cancer, colon cancer, prostate cancer, all they have staging which is based on the tumor size or the lump size, and whether it is spread to the nearby organs or the distant organs. So basically there are four group of stages for such tumors. Stage 1, you can say, is a tumor which is very small in size and is still limited to the area of onset. Like for example, if it is a breast tumor, it is very small, like less than 1 centimeter, less than 2 centimeter in size, and it is localized to breast and it has not spread to any other part of the body. Then it is called stage 1. Stage 2 is a bigger size of the tumor most of the time, and stage 3 is a tumor which has started to spread to the nearby areas. Like for example, in the breast cancer, it can be lymph nodes in the axilla. For the colon tumor, it can be lymph nodes in the abdomen near to the primary area of colon. And finally, the stage 4, which is also called advanced stage, the tumor started to further spread and it has gone to a very distant organ. Like for example, in the breast, it may spread to lungs or different bones, or maybe in the liver. Same applies for the any other type of tumor. If it spread to other distant organ, it is called stage 4. So coming to what is the importance of stage, then the curability chances depend on the stage. So the highest possible cure chances are associated with the earliest possible stage of the cancer. In the advanced
Thank you.
stage 4,
Yeah.
most of the cancers become incurable, and only what we can do is to control the situation or control the tumor for a certain period of time. But curable stages are stage 1 to 3.
Thank you, doctor. So, Dr. Virushka, staging of cancer when it comes to breast cancer. So, generally, what age group you see when they are coming to you, and how early you can, suggest to all the women they can pick and train themselves to at least recognize as early as possible the breast cancer.
So the good thing is that because of our advanced screening, we are finding patients in what we call the stage 0 phase, which is just before all the pre-cancerous cells. So now at least we are picking up at least more than 3-4, at least practical every sitting. We're advising them to do prophylactic removal of the breast lumps. So we are picking up these small tumors of less than 0.3 millimeters and at least finding them before they reach stage 1. So that's what they call the DCIS or LCIS, which is the carcinoma in situ, which we are picking up quite more often than what we used to pick up before. Now, the stage 1 and 2, we are normally seeing our population between the age of 25 to 55. In this age group, we are trying to pick up as much as we can, as early as possible in stage 1 or stage 2. But sadly, still, we are still picking them up in stage 3. So maximum population for pickups is between stage 2 and early stage 3. But it doesn't mean that if you come in stage 4 that there is no treatment options available. You can still be considered a survivor if you get the right treatment, the right management, even if it's stage 4. So I would say any patient at any stage right now can be given good treatment if their tumor biology is favorable, their age and no comorbidities. Even with comorbidities, still we are able to at least treat them properly with the whole multidisciplinary team approach that we have with our hospital as well.
Thank you, Dr. Virushka. Dr. Vipul, I'm sure what you said that it's very difficult. Patient will come in early stages of prostate cancer. And is there any particular thing patient should look forward and can maybe self-suspect that he is going towards prostate cancer? Any kind like weight loss or any appetite issues?
See, like I said earlier, and even Dr. Arun would agree, weight loss and other symptoms are usually signs of late cancer. So the key for prostate cancer is screening. If you are feeling troubles of prostate cancer, that means you are already late. And patient should be more aware because we catch it early. Like Dr. said, stage 1 is small localized, stage 2 is big localized, stage 3 is nearby, and stage 4 is far off. So if you are having problems, that means you're having symptoms, that means it is beyond localized. And if it is beyond localized, complete curability becomes a bit difficult to achieve. So the most important thing is not to see if I'm experiencing something abnormal, but the most important thing is to get the awareness and hide that inhibition, because many a times patient feel I don't need cancer screening, I don't have any family history, but that doesn't mean you are totally immune from cancers. So the important thing is not to deny the need for screening. Screening is the most important thing to get early stages and treat them successfully with full cure. That is important.
So, Dr. Vipul, you must be having a lot of patients who have come to you for urinary issues and unfortunately was diagnosed with cancer. So, how is their, what is the response to life? What is the response to treatment? And unfortunately, many people are living with prostate cancer. What is the best advice you can tell them how to cope up with the situation by all means?
See, the moment you bring the word cancer in your discussion, it is very difficult for us. Even if I'm discussing with the patient that I'm suspecting or I'm doing these tests. So the most important thing is how to break the news that yes, you might be suspected or you might be positive, and then to counsel the patient that it's not the end of the day. With the current technologies and treatment, whether it's a localized cancer or it's a spread out cancer, treatment options are available. So the patient should understand, and we should tell them for early cancers, we have option of prostatectomy where we remove the entire prostate, and we have the option of radiotherapy, which is brachytherapy, which is localized radiotherapy, or teletherapy. And if it is spread to nearby areas, radiotherapy is also a good option. If it has spread to different organs, and hormone therapy, because prostate cancer is a bit hormone dependent, is also good option. So yes, the patient needs to understand and not panic out. Panicking out will not help him. It will in fact delay the treatment and worsen the outcome. So proper counseling and understanding, especially with the family, we need to involve the family, the patient, everybody who is being affected, that yes, there is a possibility that this is there, and we need to do the staging exact extent, and accordingly we have good effective treatment options which will take care of his age. And
Thank you,
yes,
Doctor.
yeah.
Thank you. Dr. Virushka, woman diagnosed with breast cancer, and we successfully done the surgery and everything fine. She's now cancer free for that moment. How likely is the chances of her getting into cancer again?
So the chances, it all depends on the stage also of diagnosis, and also depends on what we call the biology of the tumor for breast and the genetic test of the genetic test of the patient. So these three factors are very important. So once we know these three factors, normally if you come in an early stage, recurrence should be less. But if your biology of the tumor, that means your tumor was aggressive in itself, then the chances of you coming back with it, even if you're a stage 1, can be very high. Then it also depends on your family history and your genetic test. If your genetic test is also positive or mutated, then the chances, even if you're stage 1, you can get it in the other side of the breast or in the same side if we have done only like a partial removal of your breast tissue. So in those kind of tests, we will decide, yes, it's better to go ahead with a more aggressive approach, even if you're a stage 1. So there are a lot of factors. So we can't say directly that stage 3, yes, has a higher chance of recurrence compared to a stage 1 if the biology of your tumor is the same.
So does that mean that one, even if a person is cancer free, the monitoring will remain there for probably
Yes,
life?
we have our follow-ups, which are very important, which of course we have guidelines to help us with that. So very aggressive in the first few years, once cured or once completed treatment. And then as you grow further away, then of course we still will give you less frequent checkups, but it will still be a follow-up throughout life.
Thank you. Dr. Arun, most important thing, multivitamins, because everyone wants, think that, at least my patients think that there is some miracle with multivitamin. Specifically, I want to know, is there any particular vitamin which can really help prevent cancers, and we should look for, we should check for, and can routinely help? What is the recommendation?
Okay, in general, there is no clear scientific evidence to say that any specific vitamins or supplement can improve or reduce the chance of cancer development, or it can improve the chance of cancer cure after diagnosis along with the other treatment. So at present, we do not recommend to go for any multivitamins for preventive or treatment purpose. However, there are different situations when a person is diagnosed with a tumor and they are on the treatment. There can be a specific situation where their vitamin levels are low or they are feeling specific symptoms related to vitamin deficiency, and definitely we can add such supplement to their treatment part.
Thank you, doctor. As we are almost ending the session, we should know what is the goal of cancer treatment at anyhow.
So again, the goal of cancer treatment depends on the stage of the diagnosis at the time of diagnosis. And as I previously mentioned, that stage 1, 2, and 3 are considered to be curable stages, where we always try to give the best possible research-based or guideline-based treatment so that we give the person a best possible chance of curing this cancer. So the goal remains is to cure the cancer in the early stages. However, for the advanced stages, like where the tumor has already spread to multiple organs, the goal changes to controlling the situation, or it is also called as palliative care, where the tumor we try with different options, like with some medicines, some new type of medicines like targeted therapy, immunotherapy, to limit the spread of tumor and to limit the symptoms related to such tumor, or to prevent sudden complications of growing tumor. So the goal changes in this kind of stage to a palliative intent.
Thank you, doctor. I will request for a take-home message and any suggestion for all the viewers to see.
So the best possible message will be to act fast, and not only in diagnosis or treatment, but to act fast in the improving your awareness about such disease, because the incidence is increasing very rapidly, and we should understand our own body or systems, so that if any persistent new symptom is visible, immediately medical care has to be taken.
Thank you, doctor. The topics are very vast. Obviously, we couldn't cover. These are very major topics and require individual sessions. But Dr. Virushka, any take-home message from your side?
As Dr. Asya rightly said, no Google. Take the right information from the correct doctors. Seek the right doctor. Be aware. Don't fear it, and we will help you defeat it. Thank you.
Yeah. Dr. Vipul, take-home message, please.
The most important thing is awareness. Come out of your fears. Come out of your confusions. Like Dr. Virushka also said, no Googling. It doesn't help. It only harms you. Doctors are there to follow and help you on your all concerns. You may have even the pettiest questions, but we are there to help you. The only thing is you should need to be aware and come to us. So become aware, get yourself screened. Early diagnosis is early treatment.
Thank you so much, doctors. It was a lovely session, and I believe we need to do such frequent sessions on cancer awareness at least more frequently. It was very informative for me, and I'm sure that all the viewers have learned something out of this session. In case they would like to visit Dr. Virushka, Dr. Arun, and Dr. Vipul, they can always book an appointment at Prime Hospital. The number is on the board. So my take-home message is key cancer facts. Cancer is the second leading cause of death worldwide. 10 million people currently die from cancers every year. More than 40% of cancer-related deaths could be preventable, as they are linked to modifiable risk factors such as smoking, alcohol use, poor diet, and physical inactivity. At Prime, we highly encourage timely and recommended screening. This was Dr. Asia, live with all the specialists with you. We will come back soon with more informative session. Stay healthy and stay blessed. Thank you.
Thank you.
Thank you. Thank you.